Starting Orenitram can place real demands on both patients and care teams. Education, access, follow-up, and coordination take time. United Therapeutics provides support to help manage these demands and guide clinicians and patients through the logistics of starting a new therapy. At the center of that system is United Therapeutics Cares, a coordinated program that guides individuals on Orenitram from initiation through ongoing treatment. Each individual is paired with a dedicated patient navigator, providing a consistent point of contact. Navigators reinforce education, answer questions, and help set expectations as treatment begins. Patient navigators also help address access considerations, including coverage, reimbursement, and co-pay assistance. This support can help reduce delays and limit the back and forth that often follows prescribing. Eligible individuals may pay as little as $0 per month. Through regular check-ins, navigators help individuals stay engaged during titration and beyond, reinforcing education as therapy progresses. For eligible individuals, the 90-day trial program provides up to 90 days of medication at no cost. This option allows therapy to begin while early questions around tolerability and fit are addressed. Many individuals can begin therapy in less than a week, enabling earlier assessment of tolerability and therapeutic efficacy. Specialty pharmacy involvement continues throughout the trial, providing training, supplies, and assistance from the start. For all other patients, including those who continue Orenitram after the trial, ongoing care is provided through 2 specialty pharmacies. These teams coordinate in-home training, nurse visits, medication and supplies, and 24-hour support. After starting Orenitram, patients can access myorenitram.com to enroll in the MyOrenitram patient portal for a personalized treatment experience. As a patient portal, myorenitram.com offers practical tools for clinicians and individuals, including side effect management resources, dietary guidance, and patient videos that reinforce education beyond the office visit. Together, these programs provide comprehensive support to patients after therapy initiation and give care teams greater clarity along the way. To explore each offering in more detail, visit the support section of orenitramhcp.com.
Orenitram, treprostinil, extended-release tablets. Indication: Orenitram is a prostacyclin mimetic indicated for treatment of pulmonary arterial hypertension, PAH, WHO Group 1, to delay disease progression and to improve exercise capacity. The studies that established effectiveness included predominantly patients with WHO functional class 2 through 3 symptoms and etiologies of idiopathic or heritable PAH, 66%, or PAH associated with connective tissue disease, 26%. Important safety information for Orenitram. Contraindications: avoid use of Orenitram in patients with severe hepatic impairment, Child-Pugh Class C, due to increases in systemic exposure. Warnings and precautions: abrupt discontinuation or sudden large reductions in dosage of Orenitram may result in worsening of PAH symptoms. The Orenitram tablet shell does not dissolve. In patients with diverticulosis, Orenitram tablets can lodge in a diverticulum. Adverse reactions: in the 12-week placebo-controlled monotherapy study and an event-driven placebo-controlled combination therapy study, adverse reactions that occurred at rates at least 5% higher on Orenitram than on placebo included headache, diarrhea, nausea, vomiting, flushing, pain in jaw, pain in extremity, hypokalemia, abdominal discomfort, and upper abdominal pain. Drug interactions: co-administration of Orenitram and the CYP2C8 enzyme inhibitor gemfibrozil increases exposure to treprostinil. Therefore, Orenitram dosage reduction may be necessary in these patients. Specific populations: animal reproductive studies with Orenitram have shown an adverse effect on the fetus. There are no adequate and well-controlled studies with Orenitram in pregnant women. It is not known whether treprostinil is excreted in human milk or if it affects the breastfed infant or milk production. Safety and effectiveness of Orenitram in pediatric patients have not been established. Use of Orenitram in patients aged 65 years and over demonstrated slightly higher absolute and relative adverse event rates compared to younger patients. Caution should be used when selecting a dose for geriatric patients. There is a marked increase in the systemic exposure to treprostinil in hepatically impaired patients. Please see full prescribing information and patient information at www.orenitram.com or call 1-877-UNITHER, 1-877-864-8437.